For baby items, we have lots of community resources. Alpha Family Center is a great one where you can go and get maternity items, you can get baby items. There's also Help Pregnancy Crisis that has a lot of baby items, and Pregnancy Resource Center has some baby items. If you're looking for diapers, frequently you can find those at local food banks, and if you need help with formula, WIC is a great option. Housing is a tough one. It's an issue in Kent County that we have. Housing is hard. The main resource that we have out there right now is 211. They can connect you to a lot of the resources that are hard to get any other way. In the Image is a great resource for furniture. They provide a lot of low cost or free items for families to set up their homes. For legal needs or for family legal needs, custody issues, we always refer people to our Med Legal department here at Cherry Health. That is a partnership Cherry Health has with Legal Aid of West Michigan. School is a hot topic right now. A lot of people have different opinions, and we don't know what the local districts are doing. Some are pushing back to October and some aren't, but families are really concerned about being able to educate the kids themselves at home, and they're struggling with the concern of sending kids to school and getting them sick. So right now we are just providing a lot of support for our families during this unusual and difficult time.
If you're looking for some things to do at home, since you're stuck at home so much, I would say make a list of activities that you are relaxing or that you really enjoy doing, and try and do at least 2 of them every day, and maybe even try some new things you've never done before. Some examples would be reading, exercising, sitting outside, maybe trying a new recipe. If you've got kids, you've got access to puzzles and coloring books. It's okay for adults to do those things too, or do them with your kids as a way to try some new things you've never done before. If you're not able to leave the house or leave the house often to meet up with coworkers or friends or family, I would make a list of all of the people that you're really close to and go through the list and contact a few people every single week. That way you've got that connection and chance to update each other on what's going on. If you're not able to make phone calls and connect with people that way because of schedules and jobs, I would recommend maybe starting to write letters back and forth. And that gives you another activity to do during the day. On your own at home, you can use some relaxation techniques like deep breathing or closing your eyes and doing some visualization of a calm place. You can also do some journal writing to get your emotions and thoughts out. If you think that's not enough for you and you need some assistance in managing your stress and anything else going on, that would be the time to contact Cherry Health and make an appointment with a counselor or therapist. Cherry Health is offering our counseling services via telehealth, which means we do video counseling sessions. So a client can use their phone, computer, or tablet to do a video counseling session from home. If someone doesn't have the availability to do a video session, we do have other telehealth counseling options that you would be able to talk to someone about when you make your appointment.
With the pandemic, we've seen kids' immunization appointments or their well-child checks get pushed back. What we need to do is we need to get kids back in to get them scheduled and get those immunizations back on track. So we need to set up appointments, so call Cherry Health to get your pediatrician appointments rescheduled. And those are happening now so we can get kids updated and back on track for their immunizations. When people think they're pregnant, the first thing to do is to get a proof of pregnancy. What that term means is it is an appointment that you've come in and they have done an ultrasound to show that you are pregnant, or they've done blood work to show that you are pregnant. Typically you would get a handout, and that's called that proof of pregnancy. That's a paper that shows you are pregnant and your estimated delivery date, or your EDD. Once you have that, you move on and you can get care at Cherry Health or anywhere else in the community. Once you get your proof of pregnancy, you call Cherry Health and they will schedule an appointment with the OB department. You'll have a welcome visit with a nurse where they'll run through your health history, a first OB with a nurse where you will do your medical background and the father's medical background. Then you'll have a second OB where you meet with the doctor. So that's the first appointment that you meet with the doctor, and they will do a physical exam. Then you would start your normal appointments that you do every month. Delivery looks a lot different now than it has in the past. Currently, with the hospital systems in town, you are allowed to have one support person that is present when you are in labor. Both of you will have to be tested for COVID, and we're mastering the delivery process.